because today we wanted to focus on the impact of TB on women, but we can't avoid the issue of male when we talk about gender. So before we look at what happens when someone, the diagnosis takes long and how it affects them, are there a specific way of, I'm looking at the gender-specific nuances of diagnosing and treating tuberculosis, yeah? Now that we know men are more rampant to pulmonary TB and women might not show this, the symptoms that you'd expect when it comes to TB, do we see a difference when people come to the clinics in how they diagnose men as opposed to women?
Yes, gender differences are true. Thank you for that question, because even now, as an organization supporting the National TB Program, the issue of gender has come up very strongly as a human rights issue, and it's also a part of the advocacy issue. There is a lot of differences in the way diagnosis for TB in women and the way it presents is different, and the way it's different for men. And so even in the presentation itself, you will see that a majority of the symptoms of TB, and we know these are the basic symptoms of TB, are basically a cough, where a person can lose weight, they are sweating a lot at night, or are they having a fever? So with those four cardinal signs, you'll find that if the fact that somebody is a man or a woman, there's need for contextualizing the issues to the gender of the person, because one, for example, we've seen women in their menopausal period having a lot of sweating at night and that kind of thing. And therefore, if somebody comes in and says this person is sweating a lot and is having TB, then that needs to be considered more on the fact that this is a woman who is undergoing a menopausal period. On the other end, issues to do with weight loss, issues to do with the cough and the rest. The fact that a woman could actually be having, say, weight and has not necessarily shown loss of weight, you might find that people might think that this is not TB, as compared to a man who might actually lose weight very fast because of their less fat content in the body. So that element is very important for us to address that. But most importantly, also, there are other determinants for health, as gender is one of them. Here we are talking about the ability to even access services because of the empowerment of the woman or the empowerment of the man. So you'll find that most women will often seek permission even from the man to go to the hospital, or when they're having TB, they have to, first of all, have to get consensus from the man and while taking medications. And so that kind of gender diversity should be taken very consideration, because it's a determinant of whether this treatment will be successful and even whether this diagnosis will be successful. Yeah. The other thing is the issue of laboratory diagnosis. We know that the primary way of diagnosing tuberculosis is through a sputum test. You produce the sputum, that is taken to the lab and is checked. In other senses, if somebody has extra pulmonary TB, for example, the urogenital TB, which we are discussing today, if it's a woman, most of the time they will not, first of all, think about that. They'll go to uterine fibroids, they'll do things to do with ultrasounds, and most of the time, that will not pick actually TB itself. They just pick maybe it's a mass or something in the body. So that gender diversity and gender sensitivity is very, very important for all of us to understand that it is important to consider when dealing with tuberculosis.
Yeah. Barkebo, you said something about sputum. What is it?
Yeah, so sputum, so sputum is basically the saliva which comes from the chest. Because we usually try as much as possible not to take saliva from the mouth. We try to ask the patient to get a good cough, get the sputum from the chest, which is the thick saliva, which will actually be able to pick whether tuberculosis is in the lungs or not. But if the TB is not in the lungs, then it has to be specific to that area which the symptoms are appearing. Mm-hmm. So you might not need a sputum for that test. You might need now a scan, you might need other tests which are a bit advanced to ensure that we check whether they have TB in those areas.
Yeah, so kikohozi kwa Kiswahili, in Kalenjin you'll tell us later probably. And this is a common way of testing TB. Maybe later on we can look whether the advancement to look at. But you said something very important about how misdiagnosis can happen, or it can take longer because of the ways of testing that, yeah. And this brings me to the question of, for the women who are living in rural areas, yeah, and we find hospitals that are within the rural areas might be different from the urban settings. Are we seeing a difference on how quickly or delay in diagnosis of some of these symptoms?
Yes, so geographical differences are reality. There are those people living in the urban areas, there are those living in the rural areas. And therefore, we can't say clearly that there's data to support people living in urban and the rural areas. But what has been shown is that people living in the urban areas have more access to health service. So in that sense, we are able to say geographical differences are a reality. What we have to say is that people in urban areas, people in rural areas are having different dynamics of the way they actually access health services, including tuberculosis services. One is because in urban areas, there is an ability to access health services at a closer range and advanced tests, that kind of thing, in major hospitals, as compared to maybe a woman in the village or in the rural areas where they have to really plan to go to hospital. They have to even sell a chicken or sell a goat to go for hospital checkups. And so the fact that these geographical differences occur, the more delay occurs mainly among women, especially in the rural areas, whereby because tuberculosis, again, as you know, it's not a painful condition. You will find that it is a chronic condition, no pain as most of the times. And the commonest experience I know is that for such cases, you'll find that a woman stays without getting a child. So they'll try getting a baby, and they go trying every form of treatment, every form of checkups. But tuberculosis in the urogenital system is quite difficult for most clinicians to diagnose. And so they keep on recurring and the damage continues. But in a good setting, that could be picked early, because it has been shown that it's one of the causes of infertility among women, because when the damage has been done, chances of recovery to getting to fertility is quite low. But if we continue sensitizing people that when they have these instances where a woman has tried, of course, you know, infertility is caused by either a man or a woman, they have to go, first of all, to check with a doctor to ensure that who is actually having the issue. But if the issue has been seen that it's the woman and they are not really getting to see what's the issue, it's good to also go and do a test, which we call self-angiography, which is a bit technical term there, to check whether the tubes are having that. And maybe a doctor can pull some fluid and go and check in the laboratory whether it's tuberculosis. That is an area which most clinicians have not thought, because it's a rare condition. So you might think of other common conditions than tuberculosis, but it's actually real that tuberculosis of the urogenital system is actually a reality. It's there.
That is interesting, because it's always good to understand these things, like what are the risks associated with misdiagnosis or the delay of diagnosis. And you've mentioned infertility. I don't know if when it comes to urogenital specifically in women, are there other cases or risks that comes with delay or misdiagnosis of urogenital TB besides infertility, maybe?
Yes, so there are other risks besides infertility. Commonest, of course, is infertility when the tubes are blocked and the bacteria has really eaten off the ovaries or the tubes. The other risks, for example, the tuberculosis itself can actually cause a rupture of the blood vessels within the uterus and the other reproductive organs like the cervix, and therefore the person bleeds quite a lot. And that causes what we call low blood levels, which is anemia. And the person actually can get complications of low blood levels. The other instances that the same bacteria can actually rupture and move to other parts of the body like the spine, which is the area which is very important for the brain function. And that can actually lead to what we call TB of the spine. And it can even move further to go to the brain, which is called TB of the meningitis, TB meningitis, which is a bit fatal. And the person might actually need to go to ICU, and other conditions can go to coma. So that is a bit high level of complications. But generally, the biggest worry for urogenital TB is basically infertility, which is a major issue because it affects not only the life of the person, but also the family and many other people surrounding the person. Yeah,
but for someone who's had infection for a very long time and probably the diagnosis wasn't done in time, the infection. Someone was, we spoke to a patient who said they're now having to use Pampers, diapers, I mean, because of the infection that they got, and it took longer for diagnosis. So I don't know if it's safe to say that this can be one of the risk association, or it's just something else that unfortunately got to her, even as it took longer for them to diagnose the issue of urogenital.
Yes, so thank you for that. I think that is a very sad situation. Yes, it can reach a point whereby the tuberculosis itself actually can eat around other organs around the urogenital system, including the intestines, the rectum, and the other parts. That way, it can actually cause what we call local spread. That is a local spread, which means that the TB had stayed for too long in maybe the cervix or in the uterus, until it eats off the neighboring organs. And therefore, it is possible that it reaches a point whereby now somebody needs to start using things like diapers and all that. But I know that with very good support from the surgeons, it's actually a surgical issue at that point. The patient can be done reconstructive surgery and be able to assist it, because the beauty is that when the TB is diagnosed, which is at that point, and the treatment is given, the disease actually gets healed completely. So the rest of the complications now can be dealt by surgical intervention. Somebody can go for reconstructive surgery and that kind of thing for assistance. But in essence, of course, it causes what we call the quality of life is lost, and that kind of thing. You feel your routine life is affected generally. So in general, it is a complication. It's real. It can actually cause local spread and can actually affect other organs, including the intestinal system.
Yeah. But it's good you say that once identified, TB is curable and can be handled. That gives us hope, you know.
Yes, TB is actually, once diagnosed, surprisingly, the TB medicines are very effective against tuberculosis. And we've seen patients even in our practice whereby, like in my practice, I've seen a woman who've come in with a huge stomach which has been misdiagnosed as fibroids. And when the doctor took the history, they were able to take the patient to theater. And upon doing surgery, they realized the uterus is not just fibroids which are there, but it's actually features of tuberculosis. So when that test was done and confirmed tuberculosis, and the woman was given the TB treatment, in 3 days, the woman who had lost weight from 70 kilos to around 35 kilos was able to get out of the ward, eat well, and in a month, in 3 months, in 4 months, the weight had come back. In fact, the relatives could not recognize her anymore. So it is actually a true story that if we can be able to diagnose TB, the treatment is very effective and the patient recovers completely.
Yeah, well, that gives us hope. Most of the time when we speak to doctors or other healthcare workers, they tell us that TB doesn't equal HIV, and someone who has TB doesn't necessarily means they have HIV. But I was wondering, for the cases where they have dual diagnosis of TB and HIV at the same time, are there challenges on how the issue of TB is being treated, or no, not the case?
Yeah, so that's very true. Thank you for that. I think that is very true because TB does not equal to HIV, while HIV does not equal to TB, in as much as we know that TB is an opportunistic infection. It's a disease which takes advantage if somebody has HIV. But it is not necessarily that it has to go with HIV. In fact, Kenya currently, we notice that up to 80% of the patients who have TB in some counties are actually HIV negative people. Even more than that, because our co-infection rate is standing around 22%. So it is true that treatment for TB and patients who have HIV and TB is actually the same generally. There's no special considerations for this and that, except a few here and there regarding the medicines for HIV, or somebody has medicines for diabetes and any other comorbidities. But specifically to HIV, we know that if somebody has TB, priority is actually given to tuberculosis, because TB is more rapid and can actually take advantage of the immunity and actually kill the person faster than the HIV itself. HIV is a bit chronic in that sense. So priority is given to TB, and the patient has to start anti-TBs immediately, even as they continue with their antiretroviral therapies. So we have not had any major complications regarding tuberculosis and HIV co-infection management. And there's a lot of collaboration between the HIV program and the TB program to ensure that all patients who are HIV positive are able to be screened for TB, and in case they get TB, they get treated even at the clinic they are attending, while also patients who are coming for TB treatment are tested for HIV, and in that sense, they're able to also be treated in case they are found to have HIV. But TB does not necessarily mean that you have HIV, while having HIV does not necessarily mean that you should be having TB. Yeah.
Okay. And even the complications that comes with it doesn't mean that it's because of one as opposed to the other. It's only about getting to know the issue in time and handling it. Is that what you're saying?
Exactly. So it's just getting to know the diagnosis in time and be able to be treated. What we just say is that if somebody is HIV positive, they are highly likely to get TB, and therefore, in case they need to be checked frequently for TB, and in case they get TB, their complications might be a bit higher compared to somebody who is HIV negative. So that is why if somebody is HIV positive, their care is more intense. They are frequently checked for TB, and in case they have TB, they're treated earlier compared to the HIV negative population.
Yeah.